let me explain from the outset. I really appreciate everybody getting together tonight, and I want to reassure everybody that I am not an infectious disease expert, nor am I a public health expert. I am a neurologist, and I am grateful to have practiced medicine for some 30 years and have some sense, and I've had communications with our infectious disease people at Mary Greeley as we go along. So what I'm going to give you here speaks mainly to what this disease is about, and I promise you there is one quirky thing that I have to add at the end, which will pique your interest. So hang in there. Okay, so let's go on to number 2 here, or let's see, how do I get this moving here? Maybe I'll go to the big picture here. And then I can just go to the next picture. And okay, so first thing I want to share with you is that I'm very impressed with the lay public as far as the press and interviews with experts. I think Paul Reed had pointed out somewhere along the way, Michael Osterholt, who actually hails from Iowa and is a public health expert up in the University of Minnesota. If you ever see him talk, he is dead on. I really appreciate his. Valerie Jarrett is a person who's worked with the World Health Organization, of course, Anthony Fauci. I really appreciate their various inputs. And just looking at the news page, the Morning Register, comments that I get in there and see, I think that's all very good. So I listen to NPR, I get some good information there. So don't be put off by what you see in the press. I think it's all pretty good and pretty well informed. And what you gather from all that is we don't know what the hell's going on. That this is every week there's some new wrinkle. They say, oh my God, kids can get this, and okay, it goes on and on and on. So what I'm going to do is I will lay out a general understanding. With full understanding, there are exceptions to the usual case. And as Fauci often reminds us, I don't know. I mean, I wanted to clip that and have it on the PowerPoint, but almost every day they ask him a question. They say, well, I don't know. All right, so here we go. Number 2 is just a picture of the virus. It's the RNA. It's on the inside, and you've seen all the little spiky things on the outside. The only reason to show this is to know that these are multiple targets that people are working on to develop vaccines, and that is going full course and steam ahead. Now, what I deal with, and of course, this is my crappy way of showing there's a little virus, there's a cell. The virus is very tiny, and its interaction with the cell surface is where the magic happens. And there's tons of very interesting things because one of the entry vehicles for the virus is the angiotensin converting enzyme, which lays on the surface of the cell. And many of you may be on drugs that block that enzyme. And there's been tremendous turmoil that, oh my God, if you're on an ARB or an ACE inhibitor, maybe you're more vulnerable to the virus. The answer is no, you're okay. Stay on your drug, your blood pressure medicine, it's okay. All right, but now this is the fundamental slide, and I hope we won't get into the weeds too much. But the point is, you get exposure to the virus, it builds up, and you become symptomatic maybe around day 5 or so. And then the illness continues on, usually to day 10, and then it resolves. And if you're lucky, everything is piece of cake, you're done. All right, and that's the vast majority of the cases. The reason I showed this is a little spike is because then this is when you're really spreading the virus. And so you don't spread it right away, not in the first day or 2, but by day 3, and usually peaks around day 5 is when, in a normal case, you're really shedding viruses. And the problem is you don't know that because you don't really get sick until day 5, and that's a problem. You're not really symptomatic. So for 2 or 3 days, you may be shedding virus very vigorously. I also want to show this because I'm going to come to this later on, is getting to the whole concept of transmissibility, asymptomatic carriers, symptomatic carriers, blah, 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 on and on and on. We really want to kind of capture something going on at day 3 to day 6, because that's when the person's really shedding the virus primarily and infecting other people. Okay, so this is my summary. Day 1, you get exposed, you inhale the virus or bring the virus from your hand to your face. Day 5, you really get symptoms, fever, cough, plus many, many more. And I've had some questions from other people. What about this? What about this? Yes, diarrhea can definitely be a presenting symptom. But I think most of you, I know a lot of you, you know when you're sick, you know when you're running a fever and you feel like crap. And that's when you probably need to seek medical help most of the time. So that's not right away, and it's a little ways later. And then hopefully by 10 days out, your immune system is kicking in and you're doing okay and you start to feel better. Day 14 is usually an arbitrary date. There's 2 schools of thought. If you're out day 14 and you're asymptomatic, you're not shedding at that point, and you may be able to return to work. However, it's not harmful to consider isolating for another 2 weeks after your exposure, and even if you have no symptoms. And we can argue about that all day long, but I think you'll gather from me in general that you want to err on the side of caution. And I've had some questions, but you understand, I come from a medical perspective that, hey, if we can avoid getting sick and making other people sick, let's do it. You know, yeah, you may be able to dodge a bullet, you may be able to get through this illness okay, but I would prefer not to take the risk. All right, okay, transmissibility. Usually too short period, like I say, day 2 to 7. Frustrating problem, asymptomatic infection. So, you know, so somebody doesn't have any symptoms, they have it, and they're spreading the virus. And I have some suggestions about it, and it's not original to me. I've read it or seen it on other places, and well, I'll get to it because it gets to the whole idea of testing. And I've had a number of questions from Karen Welp, for instance, about how to test and what's the best thing for testing. I want to talk to that because I think there's something we're not doing that maybe if we did do would help address this problem. I can tell you very briefly, I had an interview with a patient on video who's under quarantine because he went to a party at ISU. He didn't go to a bar. He went to a party at a person's home at ISU, and lo and behold, one of the people in the party tested positive, you know, became symptomatic. Now, what if that person was asymptomatic? You know, the guy would have not been in quarantine. He wouldn't be on a video conference. He would have been out, possibly shedding virus. So the very frustrating problem in trying to get a handle on it is not easy. Then frustrating problem, which I think is very important, is it's not one and done. You've heard all people talk endlessly about herd immunity. You know, just let the damn virus run through the population. Well, the problem is some people can acquire the virus, they can get sick, and their immunity doesn't hold, and they get sick again. So the idea of herd immunity, I think, is false. Now, maybe with a vaccine, you know, you can talk about herd immunity, but how long your immune protection lasts is a variable that we don't have a good handle on. All right, now I'm sure I'm stirring up. So this is the best way to think about the virus. It's glitter. I'm sorry, this is an ugly picture. I thought I'd have a small one with a little kid and it'd be very cute. But just think about the damn virus as glitter. It's just out there, and if you get a lot of it, that's not good for you. If you get a little bit, well, maybe you'll get by okay, and your immune system will take care of it. Now, things do go bad, and very briefly, particularly the elderly and people with comorbid conditions, diabetes, hypertension, anything, the immune system doesn't do a particular job. And then the immune system has a way of triggering what's called the cytokine storm, which doesn't give a damn about anything. It kills everything. It's killing your cells, it's killing the virus, it's killing your gut bacteria, and that's where people get into major organ failures with their kidneys, their heart, their lungs, and that's a bad outcome. That's atypical, that's not normal, but that does happen. Also, what we know now is there are people that are long haulers. Okay, they got out there 7-10 days, and they just don't feel good. And I've certainly heard testimony of people that have felt they got sick back in March, and here it's May and they're still struggling. It's almost like they have a chronic condition at that point. So that does happen. And then there were several questions about children, and there is this condition called multi-system inflammatory disease, which affects, and it's basically like a vasculitis. Vasculitis is where the blood vessel gets inflamed, and it isn't necessarily the virus attacking the blood vessel, but the blood vessel gets inflamed and thus harms the kidneys, harms the gut, harms the brain, harms everything. In general, vulnerability for the acquisition of the virus and its lethality rests with advanced age, comorbid conditions, poverty, and we can sit here all night speculating why that is. I will give you my take on it shortly. So here's my immunology riff. We have innate immunology. You know what, folks? We have a person in our congregation, Nancy Clow, who is probably not on this video, who wrote a book on immunology. And, it would be nice to have her talk, Nancy. You
guys are hung up. I'm in a Zoom conference.
So innate immunity.
So why don't you call Mom and talk to her?
The innate immunity is basically the cell and physical barriers, but they activate the adaptive immunity. And the adaptive immunity is the old antibody production by B lymphocytes as directed by T lymphocytes. Those are your white cells. And so why do some people do poorly with coronaviruses? Is their immune system strange or compromised? Yeah, there has to be. That's where the fatalities come from. And stress, I think, does weaken, and that's what poverty is about in many respects. I wonder about immunotypes, but here's your little pearl. You can take this home, and this is so funny, because when we were recruiting Brett Becker, I brought this subject up to him in Betty Baker's back porch, and he remembers it. He said, that was a weird story. So here's the story. I went to a conference last fall, and it was about immunosenescence. Immunosenescence. So do you know that we all have senescent cells in our body? We have more of them as we get older. What is a senescent cell? Well, it could be a neuron, it could be your skin, it could be your bone. Anywhere you got a cell, some of them can become senescent. The problem is, if it's your immune system, that's not a good thing, because senescent cells are not performing the way they should. And I think this has wonderful metaphorical resonance. That's why I shared it with Brett Becker. A senescent immune cell becomes very old, longer than an immune cell should last, and it does nothing other than take up space and prevent new cells from coming up. Ouch! Sorry, anyway, I just shared that with you, and that's as far as I want to go with that. So, what to do?
The same thing.
Testing. Now, very briefly, what is done, and still the gold standard, is to test for the RNA, the viral RNA. And that's with the polymerase chain reactions, and that's taking a swab from the deep part of the nose. One of the questions I had was, what is the problem with testing? Why can't we do more testing? Why isn't it more efficient? I can't answer all that, but that's still the gold standard, and it's a gold standard here. One of the advantages we have in Ames is we are taking advantage of primarily the vet school, and I think to some degree the National Animal Disease Lab, to run the test. So we have no problem with turnaround on those tests. The other thing I wanted to talk about, and I'm going to go back to the slide, is I listened to some stuff about, and what you've all heard about, is antibody tests. And what's wrong with just having, like a pregnancy test, you have a piece of paper and you spit on or urinate on the piece of paper, and if the piece of paper has the antibody to the antigen and it turns blue, well, you got the virus. Right? It's very simple. The problem is, and the reason the FDA has not approved it, is it's not particularly specific. Specificity ranges anywhere from 80 to 90%. And so if you really want to know, you do the laborious, time-consuming, uncomfortable RNA test. However, the argument currently, and of course it may change in 2 weeks, is maybe we should go for the antibody test, because then we could screen a lot of more people. We were just talking about schools, or we've talked about schools. Here's the notion. What if your child gets up in the morning and you had him spit on a piece of paper and it was fine? Then you'd be okay sending them to school. What if your child get up and you spit in the paper and it was abnormal? Even if he wasn't having a cough, even if he wasn't running a fever, well, hell, you keep him at home. Got it? So I want to go back to this. I'll get back to the other slides, but you know, if a 90% accuracy would capture these people in here, we, you know, reduce a lot of spread. We'd reduce a lot of spread of the disease, even though it's not perfect. It's not capturing 90% down here. So that's just a thought to think about and get frustrated about. Okay, so vaccine, again, maybe by January, and there's tons of deep things we can get into. And, you know, the bottom line, and I tell this to everybody, and I'll tell this to all of you, basically the good idea is don't get sick. I mean, don't get the virus, all right? We don't have good treatment. And yeah, you can weather it and you can get through, but maybe not. And you can avoid your chance of getting a virus by not being out in public, wearing a mask, avoid the closed spaces, and we can get into all the details of that. But my bias is I don't want to get sick, and I try to avoid going out, period. But we can talk about it. And then, of course, you know, all the good healthy habits. We're all dealing with the kind of the frustration of being cooped up and locked up, and try to take advantage of it. I mean, listen to music, you know, meditate, exercise, you know, try to develop a good attitude. All those things are good, and they're kind of commonsensical. So I think that's all I have. Yes, that's all I have. So now, why don't, Peter or Nancy, should I just kind of empty the screen, or what do I do? How do we get out of this? Stop share.
It should up at the top say stop share.
Yeah, I did it. Okay. Let's bring it on. Or do you want me to address some of the questions I've received?
I think that'd be good. Yeah.
Yeah.
All right. So, and I don't know whether Karen is on the communication, but she sent me a lot of questions about children in schools, and I kind of touched on that a little bit. And I'm giving you my opinion. It's a bad idea to have in-person school. And I think virtual options would be great. I think that there is 1 in 6 children in the state of Iowa who are food insecure, who are in bad situations. And I think for those children, school is valid and valuable. And perhaps just finding a way to space out. I talked to a teacher, where the hell was that? Well, it may have been here, who's saying, well, she's got second graders and she's planning to have her classroom for the month of August and September out under a tree. And I said, that's fine. You know, that sounds like a good idea. Have them wear a mask and, you know, do the best. Now, Karen asked about testing, and I gave you my little highlights on the testing. I don't want to go further on that. And then
if people that could mute Down in the bottom corner or the top corner, there's a microphone that you can click on to mute so that we don't have as much interference. And if you have a question, you can unmute yourself.
Great.
It'd help a lot.
All right. And
Yeah, Sheldon, could I just add something about the testing?
Yeah.
I just got some up-to-date information today about the testing. We still have a shortage here in Ames. I think that since we can do the testing at the vet med school, that would solve the problem. The problem is right now, the only way you can get the vet med testing is if you meet the criteria for the Iowa Department of Health, and that is you'd have to be symptomatic. Now, the students, when they come back, the ones that are going to be on campus, they are going to all have the vet med testing, and that'll come back within hours. They'll get it in the morning, they'll have the result in the afternoon. But the off-campus students, that's 20,000 students, will not have any testing unless they get symptomatic and then they go to a provider. So they might go to the student health, they might go to McFarland Clinic. The problem is, other than the vet med testing, we have a severe shortage of testing. There's a test that the hospital has for really sick people in the ED or in the hospital. They can get that result the same day, but they only have 100 tests, and they only are expecting supply to be able to be used for a week. So we really have a shortage of testing. And so unless you're symptomatic, you will not get tested. So until we have a real change in the availability of testing. And the thing is, in Iowa City, the students are not even going to be tested, because the problem is if you test them on day one, what if they get sick on day 3? So the University of Iowa is not going to run any basic screening tests. They will only do it again for the symptomatic students. So that's my report.
all right. Can I pick it up again here? Yeah. Okay. So thank you. I wanted to finish up the questions from Karen. She talked about the outbreak in Georgia, again, children, and what is the virtue for child development of not being in a school? And again, I resonate with that. That's difficult, and I kind of gave you my 2 cents worth. Now, and she had a bunch of other questions, and I think I've touched on them, but I wanted to get to, Dick Richmond sent me a very interesting note. And Dick, I see you're here, so if I get it wrong, you jump in. But the deal is, from his perspective, he was commenting on the frequency and severity of this illness. And in truth, it is not commonplace, and it is not the leading cause of death of anything, for sure. But here's the problem from my perspective. As a doctor, everything is first do no harm. And this is a source of death and morbidity that we didn't have before. And the simple question about how do we define a pandemic, it's when you have a new entity that is worldwide. That's why it's called pandemic. And so I hope that kind of it is, he's, you know, we're all kind of glued to the tube, and every day they talk about the pandemic and the number of deaths. And you know, you wonder, oh, is this getting blown out of proportion? We didn't have it before. So, you know, it's incumbent on all of us to try and reduce the number of deaths and the number of morbidity related to this virus until we can figure it out better. I don't know whether that answered it very well, but you can kind of, I'm open to, that's the only questions I had, and I'm all ears.
Well, my question, Sheldon, Larry Middleton speaking. When Governor Reynolds says 15% in a county before a school can go all virtual, is she talking first 15% of the county population or 15% positive rate of the testing?
Yeah. Mike, you want to jump in on that? My understanding it's 15% of the population.
No, actually, it's 15% of the tested people. Right now, we have a rate of about 7 to 8% of the people who get tested are positive. And so she's actually talking about 15% of the people who get tested. If you had 15% of the population, that would be a huge number of people. We only have had testing for about 10%, maybe 12% of the population in Iowa. So the testing is going up very rapidly. But again, that 15% is how many of the people tested were actually positive. And that's actually a pretty good marker of the prevalence of the disease. So, but that's actually pretty frightening to me. I think 15% is really scary.
Thank you.
Thank you.
There are some questions I've been hearing. Are the Iowa State numbers that are being, anything that comes out of that testing, is that related to Story County, or is that going to be related back to where the students are coming from? I don't feel like that's 100% clear.
Yeah, no, that was in the information today. So the students, if they're in Story County when they're tested, they will be counted as Story County.
Wow.
So what's the advantage of starting school in September rather than August? What are we hoping for?
Well, if you listen to Michael Osterholm, his opinion is we need to shut everything down and wait 2 weeks and see if things will get better. So that would take us out to September. And I think if you're really harsh and cold about it, that's what happened in Europe, everywhere else, and in Asia. You shut it down and don't let people go out or just stay quarantined or whatever. And that might chill the virus away a little bit. And that would give us, we're still early in August. We might be able to be cleaned up by September. And that's the cold public health approach. I don't care who you're looking at, Valerie and Jarrett or Michael Osterholm. That's their perspective.
But waiting 2 weeks if nobody's shutting down doesn't really give you that same effect.
No.
Actually, Peter, if we got everybody to wear masks and really have social distancing, we could get this under control in 3 to 4 weeks. That's happened in other states. That's happened in Europe. And they got their cases down into the hundreds while we're in the 70,000 range per day. And now in Europe, when they've been relaxing it, it's starting to creep up again. But again, if we can get everybody to wear masks and everybody to be socially distant, we can still have a pretty normal life and we can reduce the number. But we only have 54% of the population that's wearing masks in public. So that's not good.
The question to go along with masks is it okay to be without a mask if you're doing a socially distanced chat, like if you're with friends but you're all 6 feet apart sitting in chairs? Is that enough, or do we have to have masks on and sit 6 feet apart?
Oh, Susan, this is reminiscent of the ROC conversations, isn't it?
And well, it is, but I feel like they keep changing the information too. And now they talk about, well, gosh, if you sneeze, that travels much farther than 6 feet. If you cough, goes much farther than 6 feet. So I really don't know.
Right. I don't know, Mike, if you have any special information, but my attitude is if you're going to be with people outdoor or indoor and you're 6 feet away, you wear a mask.
Yeah, just do both.
Yeah, actually, I think we should all look at this as a relative risk. I think if you're outside in you're socially distancing and you're not doing it for very long, the risk is actually very small. But they've got a nice diagram where if one person is wearing a mask and the other doesn't wear a mask, the risk is moderate. If they both wear masks, the risk is low. So that's the same with social distancing. The more protection that you have, the less the risk. And the longer you're exposed to somebody, the higher the risk.
Okay.
So what's the future here? If we don't shut down, and I kind of doubt if we will we just keep at the same kind of numbers we have now, or will this go on forever? What's going to happen?
I'm the expert here, and I'll tell you the answer.
Thank you.
At any rate, no, I mean, I think this is brewing. I mean, it's very dispiriting. Every week, you know, I get some new news and kind of say, well, shit, this isn't going away. And I think this is going to grind along. I don't think it's going to blow up in our face. I was looking at some graphs today, and it's always, you know, this day there's 100 cases, and the next day it's 20. And I just is going to grind along. And then when flu season hits and we have to deal with the flu season, we'll be totally balled up. I'm thinking this is going to grind along until January in the winter, and that's my expert opinion as a neurologist, not infectious disease, not public health. Take it for what it's worth, okay? You didn't get a dime for it. There you go.
Delvin, I think if everyone just had the attitude that this is going to go on for, say, a year, and you just wear a mask, socially distanced for a year, and not try to do all this figuring it out because it's too unknown. No. It's so simple to wear a mask and stay away. It's not easy for everybody. It's not easy for the poor kids in Nevada, for example, 60% on free lunch or whatever. But in my opinion, the school districts shouldn't be having to feed children anyway. No. We should be doing that some other way, but that's a whole other subject. But the idea of sending kids and teachers to school as an experiment, that's what this is. That's anathema to me. I think it's crazy. I think it's crazy. There ought to be another way to do it. At least mandate masks, at least. And I think the governor is really...
I did talk to somebody on the school board for Ziering, Colonesco, and he was asking the same thing. And I said, by God's sake, everybody's got to wear a mask. If you're going to gather together in school, everybody's got to have a mask on. And, you know, whatever else you can do to socially distance and use the space of the school, please do.
My friend in Nevada said they're not requiring masks. She's keeping her kids at home. They're going to do homeschooling. Yeah. Homeschooling is going to really take off, which may be good or bad. I mean, I don't know. But I think it's cowardly of the administration of any government, any party, to not take responsibility for everyone by mandating a mask. I don't see what's wrong with that. I'm just having trouble with that, but I don't know.
No.
Then if you mandate a mask,
yes,
it has to be enforced.
Yeah.
That may be true.
That's the hard part.
I see.
Yeah.
Now, some places manage to do it because they have heavy fines if they find people not wearing a mask.
Well, think about it. Smoking used to be public, right? Everybody could smoke anywhere. It became socially unacceptable as well as clinically unacceptable. And now it's legally unacceptable. If we can do that for cigarettes, why can't we do it for a mask? It seems easier. I don't know. I'm just frustrated.
And if you go into a restaurant, no shirt, no shoes, no service.
Yeah.
And people accept that.
Or seat belts or anything. I mean, it's just, everybody resisted seat belts. Everybody resisted smoking laws. I mean, you know, it's just, I think we really need strong leadership. And I don't know if you followed the lady in New Zealand, the prime minister who's 29. She's amazing. She gets on the TV every day in her pajamas, having empathy, talking to the people. Let's do this together, blah, blah, blah. She's amazing. We need to elect her president. Well, that's my rant. Go ahead. We're very thankful, honestly, to be in a sheltered place. We see grocery deliverers and mail people. We have plenty to do. We're very happy. I'm very happy. He seems to be happy. I hope so. Anyway, I feel guilty we're so happy, honestly. I wish we could do more for other people because there's so many people struggling. I mean, they say these numbers like it's cattle or something. These are 150,000 people who've lost their families. This is not good.
And let alone all the people that are going to be losing their homes because they haven't had jobs and they can't keep up the things. That's, I think, what's really sad. But the other thing we have to remember that when this talking about the schools is the parents. Some parents are good at remote learning, but a lot of parents too are having to work. And then what do you do with your child?
Right.
You know, you can, maybe a high schooler could go online and learn things and be, you know, hopefully be self-motivated. But I think some of you who have taught high school know how that can go sometimes.
Sure.
But what do you do with a kindergartner?
Even if the parents are motivated, they do not necessarily know how to do it. Parents need help too.
You know,
How many teachers out there have tried to teach their own kid? It's not easy.
My friend Dan Andrews, who's the school administrator, was kind of getting irritated with all these people making advice for teachers online, you know? And he said, hey, all you people with those good advice for teachers, that's great. Thank you so much. Why don't you sign up to be a substitute?
Well, the governor in her wisdom has decided that all it takes is 2 years of college to be a substitute. Doesn't have to be an education, doesn't have to be anything related to it, but because she expects a lot of teachers to become sick, she really reduced the standards for education in Iowa.
Well, that's sort of like the national director of education. I mean, the one that never went in a classroom. Anyway, let's don't get off on that.
It's just daycare is all it is to the governor.
I have a couple questions I want to make sure to ask before I have to butt out for another thing here. But first is just, I'm wondering if others are having the same question, and that is, we're not traveling right now, but we do, like we've gone as far as Des Moines, basically. And of course, before we left, we're like, all right, everybody go to the bathroom before we leave. We don't want to stop at any rest stops or anything like that. Well, invariably, you end up having to stop at a rest stop. So how can you safely manage those kinds of stops is my first question. And my second is, what is the difference going to be between the first wave of this and the second wave of this? Because they're always talking about, no, we're still in the first wave. How do they figure out when you're, you know, you finish the first wave? How do they know a second wave will come, and how different will that be?
Well, as the expert, I will jump in on both. Though I think if you go to a gas station, you know, that you wear your mask and feel free to use wipes, anything you touch, and just keep wiping your hand, use sanitizer of any sort. So bathroom stalls, all of that stuff, just wipe, and that's your best bet. As far as the second wave, you know, Susan, I really don't know. Maybe there isn't a second wave. Maybe this is just grinding like this. And, you know, we'll now, the second wave will really be when we're trying to figure out what's flu and what's COVID. I don't know, Mike, you have an opinion or?
I tend to agree. I'm not sure we're gonna down low enough to say we're done with the first wave, but there's no question that what we need is down, the risk is lower. If we ever want to get back to church, we've got to get the numbers down so that the risk, if you go to a church, you can socially distance, you can wear masks, you can use the hand sanitizer when you come in and when you move around, and don't touch your face. And then we won't be able to sing for a while. We won't be able to chant for a while, but we can at least get back to having some social distancing in church. But again, I think we need to have a lower number of cases in the population. That means lower number of people that are spreading that virus. And until we get through with the Iowa State students coming back and seeing what happens then, and until we see what happens with the schools, because these teachers are really frightened and these parents are really frightened too. So we hope it won't break out, but if people just would socially distance and wear masks, we could get this thing under relatively good control.
Selden, I had a question for you. Does it help, say, for the bathroom rests or whatever in your travel? Not that we're traveling, but does it help to wear gloves too?
Yes.
I mean, if you wear gloves when you're out and about maybe, and then take them off.
Yeah, I've seen some people, I'm not doing that, but I've seen people wear gloves, and that's wise. Okay. Judy, Hope, you've been wanting to say something. I see you there.
Yeah, I was thinking, can you hear me?
Yeah. Yeah.
Okay. I was thinking that, you know, Kim Reynolds says that she's going to depend upon the smartness of the people of Iowa. But when you see so many people going into stores without masks on, you wonder about that. But I've been in several stores, and I've talked to the manager and told them they should require people to wear masks in the stores, and more of them are. But I have noticed the ones that are requiring masks, everybody wears a mask. If they don't require it, they don't wear one. Yeah. And I mean, some people are worried about violence and that sort of thing. But I just think that people are more likely to wear them if they're told they have to wear them than if you just depend on people being good to do it. So that's my two things.
I got a question in the chat room, Peter. The question is a good one. How early should we get the flu shot? And I don't know, Mike, if you're still on the line, but whenever it's available, get it. You know, September.
Earlier is better.
You know.
I have a question about shots. Should you get a flu shot if you're worried about flu shots and vaccines for COVID, or does it make any difference?
Okay.
No, the COVID virus and the influenza virus are completely different.
Okay.
So they can cause a similar illness, but they're completely different viruses. So the vaccine will only be specific for the flu. And when we get the COVID vaccine, it'll be only specific for the coronavirus.
So they don't hurt each other. I mean, if you get one, it doesn't matter about the shingles interfering with the others or anything.
Right. Well, if you've had the shingles virus, you know it's bad, and you know that the shingles shot had some reactions too. We'll have to wait and see about the COVID vaccine, because we hope it'll be not so difficult to deal with, and we hope it'll be effective, but that still remains to be seen. I guarantee you doctors and nurses will be the first round of the vaccine. So we'll let you know how it goes.
Thank you.
So let me tell you a couple of stories from the front line, just kind of interest. The one is that I had a professor at ISU who is fully expecting that ISU will shut down by October because it'll just blow up. You have, as I told you the story earlier, it's not just going to a bar. Kids want to get together, they want to party, they want to drink, and they're going to get together at somebody's house. And so anyway, that's her perspective on it. Had another story of some sort or another. Anyway, I've talked to people that have had it, and the lingering illness is a real thing. I think from my talk, I framed it that it's uncommon for somebody to die and get horribly. Is it 1%? Is it 2%? But you know, it's just not worth it. You know, try to avoid it. I mean, people die of flu, and we try to avoid that as well. I'm sorry. Okay, let's see. There's another thing. Can you speak to the brain fog that some COVID patients are experiencing? Is this, and this was done through the chat room down at the bottom. So can you speak to brain fog that sometimes patients experience? Is this a valid neurologic symptom side effect? Are there others? Well, the biggie for us from a neurological perspective is stroke. And this is the tragic that COVID victims that are young have strokes. How common? Not that common. And it speaks to this whole idea that the virus can create a semi-vasculitis or an inflammation of blood vessels. As far as the brain fog, that's a mystery. I think it's a real thing. It's like chemotherapy. Sometimes you have people on chemotherapy, they just cannot think. They're just in a fog. And Frank, I don't know, Mike, if you have any understanding on that. I know it's a real deal, and I think it's uncommon, but it's a concern.
No, I think, Selden, you described it really well. We see strokes. We also see inflammation in the brain. We see a vasculitis. There may be other manifestations that we'll see, but some of this brain fog occurs even after people recover. So that's clearly going to be a concern long term.
Oh, I guess you answered it. Thank you.
So a question I have is, I already did. When do we know we need to seek medical assistance? I mean, every time there's a cough or, a sniffle or a stomach bug, when should we contact our doctors, even if we don't have a fever?
Yeah, I'll give it a crack. My thinking is, everybody's got it, and Anita, that's just a great question in the sense that everybody has their own threshold as to when you think you're sick. I know when I know I'm sick, I say, geez, I don't feel good. And I think if I don't feel good and I don't have a good explanation, I'm going to call my doctor. All right. Okay. So yes, you'd like the trifecta, or not a trifecta, but anyway, the cough and fever and shortness of breath. And then you would probably call your primary doctor, and if they agree with you, you'll go to North Ames to the COVID clinic up there, and they would do the testing on you. And they probably would not do anything. They said send home and stay home and don't kiss your husband or something like that.
Darn.
I would agree with Selden. The first thing you should do is call, and they will give you good advice. And so don't just go to the emergency department, don't just go to the doctor, call, and they will direct you. If you are highly suspected for having the virus, they will send you to our North Ames office. If you're so sick you can't walk, you can still call the ambulance. But again, the first thing you should do is just call. And, the worse you feel, the more you need to call.
Okay, thank you.
So there's a question here about online instruction. Would small pods be okay option for families? Yeah, I've heard about that. That's actually the other thing I was trying to remember. The guy, I had this medical student here that did my PowerPoint for me today. His wife is a teacher in Johnston, and she's all freaking out about trying to go back and teach. And I think she teaches mathematics, and nobody likes mathematics anyway. So she has at any rate, she is in communication with this online teaching group, and she may well opt out of teaching at Johnston and just do online teaching. But he said that there are families in Johnston that are pooling together their kids to do online instruction that way. So it's kind of like homeschooling in a way. We'd like the imprimatur of public education to know that kids are actually getting education. I want to tell you another story. There's a gal in Huxley that I know, actually some of you may, a former county attorney, Jessica Reynolds, is now working downtown in Des Moines in the Attorney General's office, and she lives in Huxley, and she's having a ball because she is only allowed to go down there one day a week. She's doing all her work from home, and she said, I never thought I'd be able to homeschool, or I never thought I'd be a stay-at-home mom. And now for the first time, she's able to hang out with her 6-year-old and her 10-year-old and is having a ball. She's loving it. And, you know, that's the age where they kind of listen to your parents a little bit. And so you can get away with things. But, you know, things can be wonderful for some people. But I think, as Polly was kind of saying, those in society who are in bad shape, this is horrible. This is an absolute torment. And I don't know what we can do. You know, CPC, we got to rummage around and keep thinking about things we can do. I mean, God bless people that help out at Food on First. That's handled very nicely. And so maybe that can expand and maybe we can support a little bit more. But the education thing, this is just as, you know, from a medical perspective, from my perspective, we shouldn't open schools. I just think it's inviting disaster. And yet, what are we going to do? We can't, I think the hybrid systems, hell, the teachers are plenty smart. They can figure out ways to get this job done. And I heard some stories from teachers along the way of how they might be able to organize it to get it done.
Airline travel.
Oh, yeah. No, I'm not in favor of it, but I'm kind of a chicken. What about you, Mike?
Oh, again, it'll be safe to go to school or it'll be safe to go to church when the amount of the disease is finally under control, but it is not under control right now. So until we get people serious and wearing masks and socially distancing, I agree with Selden. I don't think it's safe yet.
Oh, yeah. Look at the question was about loss of taste and smell. And I love that because I actually, I used to do, when I heard about this first, I actually have smell tests here because loss of smell is an early indicator of Alzheimer's disease and Parkinson's disease. And so I have, if you want to come to my office just for the smell of it, we can test your smell. We can do an olfactory test. But, you know, practically speaking, it is very common for people to have impaired smell. And so it did not hold water to make that as a screener for COVID. I don't think. I don't know whether you heard anything, Mike. And, you know, if you want to do a detailed test of smell, it's not going to be a quick thing. You know, you have to do pages of scratching and stuff like that.
Actually, though, Selden, I think most people don't realize it, but our taste is actually mostly determined by the smell of the food that gets up into our noses. So you would notice not just a loss of smell because you could just have congestion in your nose from allergies. So if you lost your sense of taste, not just salty or sweet or sour, but if you lost your sense of taste of good food, that's when I would get concerned. But I think that's the least of people's problems if they get the COVID virus.
Yeah, I want to throw in one thing about the COVID virus that really impressed me is the shortness of breath that occurs with people. That is, what was fascinating was listening to a pulmonologist talking about how it mimics high altitude experience. For some reason, a person is short of breath and their oxygen saturation is down below 90% and they're not freaked out. They're not, you know, they're not seeking help. It's very weird. It's kind of like the shortness of breath that mountain climbers experience without supplemental oxygen. So from a neurological perspective, it's very interesting as to why aren't they not registering that their oxygen levels are low. There's a lot of, you know, lots of things about this disease that are unusual and
we got one of the little oxygen meters, you know. You can put it on your finger and it tells you if your oxygen supply is adequate and your pulse rate. You can get one on Amazon.
Yeah, that's true.
They say it's only about 80% accurate, but it's something, it's one more way to see if you have symptoms because you don't feel it. You have low oxygen.
Yeah.
You can't tell it.
Yeah, it's weird.
Actually, the majority of the people that are diagnosed as having COVID and are not doing too badly, they actually get sent home with one of those oxygen meters by their doctor. And so we at the clinic have a lot of our primary care physicians monitoring people who have COVID infections at home. Most of them are going home now. They don't hospitalize very many. They're only if their oxygen level is too low or they're really having a lot of symptoms. So we have a lot of primary care doctors that are following people in the community who are infected, but they're quarantining them in their own home, and they do monitor their oxygen as well as their fever and the other symptoms.
At Northcrest, they're asking us to take the temperature, you know, the touch-free temperature, and wash hands and log anybody that comes over. And they're allowing 2 visitors once a week if they're the same visitors. Or you can have 5 people socially distant and mask outside, you know, in a pergola or whatever. So they're pretty strict, but nobody's come down with it yet. So we're thankful for that.
All right, Virginia has a very good question in chat room, and I'm going to punt it to you, Mike. What's considered a low number for spread we should be aiming for? And this gets into the whole R value. It's the frequency of positivity of the test, right?
Yeah, exactly. Once we get down to 1 or 2%, assuming we're still doing a lot of testing, then 1 or 2% I think would be comfortable. I don't know exactly what the experts think is a comfortable level, but you know, in Story County, we've had about 8 deaths, I believe, and in the state we've had 888 deaths. And so the cases, though, in Iowa are over 47,000 cases, and so we're still having approximately 100 cases per day in Iowa, new cases per day, maybe more than 100 per day. So.
And most of those hopefully will survive and do well. I would add also Mary Greeting Medical Center currently has 13 cases in the hospital. 4 of them are in the ICU, unfortunately, and that's not a good thing. And I thought it was also interesting, over the time, 27 staff members at Mary Greeting Hospital have tested positive. So far, 25 of them have recovered, and there are still 7 that are on leave trying to figure out what's going on with them. So it's many wrinkles, very things, but I hope that covered it for you, Virginia.
I have a question.
Yeah.
Frankie Parrott. We have a daughter who is a 5th grade teacher with asthma. How much of a risk factor is that?
Big.
Yeah, from my perspective, any associated illness is a problem, whether it be diabetes, hypertension, pulmonary disease, and pulmonary disease does give you a little measure of more hazard. Mike, what do you think?
Yeah, I think everybody should realize, though, this is also on a continuum of age. So the younger the person, probably the less risk, but any cardiac or pulmonary, you know, lung disease is definitely a higher risk. And so you add the age and the diseases together, diabetes is a very high risk. And so again, the younger diabetics are not as high risk as the older diabetics. But again, there would be a little higher risk, yes, with the asthma of any age.
I want to throw in another thing that's just kind of a wrinkle that I've been interested in. Where is it? I want to show it, show off. This is how I go to work every day. I have this on, you know, and I have seen in other countries that the students wear this kind of thing. This is easier for you to see the lips. I've heard a report that people that are hearing impaired need to be able to see the lips and see how the mouth moves in order to understand what the hell is being said. So while we do promote face masks because they're relatively easy to access, this isn't so bad. This is not so bad for your own protection and for you not doing stuff on other people.
If you have that, Sheldon, I bought a couple of those in case we need to go somewhere, but Do you wear that plus a mask, or just that by itself is sufficient?
Yeah, no, that's my standard thing is mask and this.
Yeah,
When I
that's
see patients, that's how
That's my thought.
I think Amanda said they're getting.
Yeah, they are. I know they are.
And we, what you were saying, Kelly, is that to come into the medical arts building, you have to have your temperature checked. You're asked certain questions, and if your temperature is okay, you get a little sticker and you can come into the building. But we've made strenuous efforts to try and keep people out in their cars so they don't hang out in the lobby or in the waiting rooms. They come almost directly into the building and to the exam room.
Do we have any more questions?
Hello? Hello?
Yeah.
Can you share anything you know about vaccines?
There are a number of targets that they're creating a vaccine. So they're trying to carve out some of the RNA of the virus. They're trying to carve out those little spikes of the virus. It's still to be determined which of those little targets will provide the most powerful immune response. I mean, it's a crazy rat race out there. And I wish you well. Many of you know my daughter, Sarah. She lives out in Boston. And she's working from home, but her regular office is right next to Moderna, which is one of the vaccine companies that's high on the list. And she's very worried about it. I mean, she thinks that there's a lot of sketchy things that are going on in terms of vaccine development. And so we best be very careful. Certainly, there's been a lot of crap that's gone on with this whole pandemic to this point of what's new, contractors being paid big bucks for crappy results. And you just have to do the best we can with that. But I don't know if that answered your question at all, Ms. Haynes.
Yeah, yeah. Mm-hmm.
Okay. A little bit more about positivity rate. If more people are tested, the rate actually drops. Yeah. All right. March, 14 days. If viewed from March, then would the reported rate be lower? Well, the thing I want to speak to about the testing rate and positivity rate is something that I'm still a little stressed out about, which is from day one, we've had crappy testing. From day one till now, we have crappy testing. How can we know what the positivity rate, unless I get tested? I haven't been tested. How can we, that's why I brought up that whole thing of doing the somewhat crappy antibody test, because that's cheap, fast, we get everybody tested. And until you do that kind of thing, I don't know that we're going to have an idea of the positivity rate. Right now, the positivity rate is dependent on symptoms. And we have a factor of asymptomatic carriers and spreaders. I don't know that answered the question. I don't know, Karen, you want to jump in and ask it, or?
Yeah, I guess my point is really back to our governor saying that, schools will need to meet in person until we get to a point where there's a 15% or greater positivity rate. Is she looking at a positivity rate from the beginning of time, which we've never really ever hit that rate? Or is she going to look at it on a weekly basis? And, if we're doing more testing of like ISU students, I would expect our rate isn't going to be maybe as high.
Yeah, I think it's weekly. Mike, do you know?
Yeah, it's a weekly thing. And your point is a good one. The more testing we do, hopefully the rate will go down. But that's why if the rate does go up, though, that's what's really scary. Because we are doing more testing now. Like I say, we still have a shortage of testing here in Story County, and the vet med department has really helped a lot to be able to test the students. But just as Karen said, most of the students are hopefully going to be negative, but the problem is that there could be just one spreader who doesn't wear a mask and is asymptomatic and walking all over the campus, and all of a sudden, 50 students get sick, and then they spread that to 10 other students apiece, and all of a sudden we've got a catastrophe on our hands. So that's why Sheldon said there are some people that are really pessimistic about us being able to control this. So again, the governor is really giving herself a lot of leeway. If the positivity rate actually was 15%, we would be really hunkering down at the hospital and fearful of a whole huge surge of people coming in. Let's hope it never gets that high. I think, again, a 9% rate like we have now is too high. And I think we need to continue doing more testing. But as I said, the testing is only good for a while, because if the students are negative on day 1, if they the virus on day 6, they're going to turn positive later. So it's not going to be all that comforting.
Yeah, well, that's why I promoted that idea, Mike, early on about trying to do the antibody test, which is cheap and you can do it every day, even though it's not accurate.
Are schools thinking about doing that?
No, it's not FDA approved.
Oh.
It's an ISU.
Drug Administration has to approve tests that go out into the public. And
how long would that take to have happen?
I think an act of Congress, and that ain't going to happen. So
There's an ISU student who's developed this little test by paper.
Right.
You send it home, and it's supposed to be really good. Maybe that'll come through eventually.
These RNA tests are going to be better and better as we go along, and hopefully they'll be more available. But again, there's always the concern that you can be negative one day and positive in 2 days.
Yeah. So there's a question here about vaccine availability. What is your confidence in its effectiveness? Actually, truly, yeah, it's a good question. I you're talking to Mr. Pessimist here, but I do believe that I have confidence in the industries that are working on the vaccine. I think it's very rational, and I think that the antibodies will be produced to the coronavirus. It is possible that the coronavirus will mutate between now and then, and the antibodies won't be of any particular value. But that's where I'm optimistic. I mean, I think that the vaccines might work. And not going to be available until January, I don't think so.
I guess the question I have is if people are, how long will the immunity last? Will it be a vaccine we have to take twice a year for the rest of our lives?
Yeah. Right now, I think you can count on 2 or 3 months. I think that's what you would imagine with it. That's kind of, I don't know, Mike, what do we get out of the flu vaccines? You get up 3 or 4 months, try to get us through the year.
Well, you're right, though. The flu vaccine actually mutates more quickly than the coronavirus. But exactly, these are all estimates and guesses as to how long the vaccine will be effective. We all hope it'll be, relatively more effective than the flu vaccines, because again, I've had many times had the flu despite the fact I got the flu vaccine. But at least if we get the coronavirus and we have some immunity, maybe we won't die. Maybe we'll just be and get over it. So again, it's just too early to be confident. We can all be optimistic or pessimistic, but right now, science is advancing, but we just don't have the final answer yet.
Well, I wish we had some beer or something like that, but.
This is Etha Hutchcroft. I would just like to say thank you very much. This has been extremely helpful. I also would add that my 30-year-old granddaughter in Australia did have COVID, a very light case. She did lose her sense of taste and smell. And to make her grandmother feel better, she sent a video eating an extremely hot pepper and not tasting anything. No sensation.
Yeah, well, actually, just to give you a personal aspect, you know, Mary and my daughter, Ellen, is an infectious disease faculty member at the University of Texas in Dallas. And so she's a frontline worker against the COVID virus. And that hospital is bursting at the seams in Dallas because of the COVID cases. And luckily, Ellen hasn't gotten sick yet. She's obviously very, very cautious and careful. But again, she really does caution people when they go to church, please don't sing. You are going to really spread the virus. That's why I'm saying when we get back to church, I think we'll be wearing masks and we'll be socially distancing. And I think we'll be able to get back to church when the rate goes down in the population. That just means the risk is going to be pretty darn small. And hopefully we won't have any of us older people getting sick, because that is really, we're the high risk population. And so I hope we can get back to church, and I hope the schools will be okay. I hope Iowa State has the football season. And
cheering at a football game probably isn't advised either.
Yeah, yelling and cheering, you should just calm it down a little bit.
Wave.
Thank you so much, Mike and Selden. It was really, really informative.
Thank you very much. And good night, and peace go with everyone.